Okay, we're going to move on now to section number 1, but module number 2. And as I have mentioned, self-management is the name of the game. In England, they have a National Health Service. I had the opportunity to work there one time for a couple months in London. And there are good things and not good things about the National Health Service. But here is one really good thing. Their health system vision is that self-care is a nationally accepted starting point for all personal health management. And that is definitely what we are focused on in this course. Dr. Ian McInnes from Glasgow, Scotland says, and he's a major researcher from Scotland, he says it is wise to consider all non-surgical treatment options before resorting to an artificial hip or knee implant. So this is the philosophy we're talking about here. Let's try everything conservative before going on to these more radical procedures. Self-efficacy, I've learned about this term in the last several years, and it's really important. It is the confidence within yourself to manage a health challenge rather than be managed by it. And that is exactly what we're trying to build in this course, is self-efficacy. When you develop skills, knowledge, modifications of daily activities, and you see the results, then you have more self-efficacy. You have more confidence that you can manage the condition. Self-management of any musculoskeletal condition is recognized worldwide as the first treatment of choice. It's conservative therapy before considering any other option. Now, this statistic, I only was aware of this maybe a year or two ago, and I was really shocked when I saw this statistic. Only 23% of Medicare patients had a trial of physical therapy before having a total knee replacement. To me, knowing what physical therapy can do, it's criminal to not have a trial of conservative therapy before considering total knee replacement. Back, neck, shoulder, hip, and knee, all different joints have excellent potential for self-treatment. Even years after surgery, some patients have excellent potential. In the booklet, I give several examples of this, of just patients that I've seen. Some who've had multiple surgeries over the years, some who've had failed surgeries, total knee replacements, and they've gotten better. So invasive approaches are needles and knives. And most people want to avoid invasive and expensive treatments. Most will welcome conservative treatment if it's available. And in this course, it is available. You can gain independence from practitioners by learning self-management skills. And then you can use those practitioners as consultants. The knowledge and skills empower you to be a better decision maker. So my goal with a patient is that by the end of therapy, they are thinking like I do as a physical therapist. and they're going to be empowered. They're going to make better decisions. They're going to have more confidence. Self-management can save you money. Those of you who have high deductibles and copays, if you're uninsured, or if you're over 65, you have a lot of health expense. Now, I've listed here the average person over 65 incurs $250,000 of healthcare expense. I've seen an updated number on that recently, and they're suggesting 300,000. So let's save some money. In Module 3, we're going to talk about the limitations of MRIs and X-rays. And practitioners who do the MRIs and the X-rays should make you aware of these limitations. So your X-ray says you have osteoarthritis, sometimes referred to as degenerative. The Cleveland Clinic says 80% of adults over 55 have osteoarthritis. Signs of osteoarthritis are normal aging in many people. They're not serious and really are normal. Knee spurs, they're called really extra bone growth is what they are. In the Journal of Osteoarthritis and Cartilage, 217 subjects, all with osteoarthritis and knee spurs, they were not necessarily associated with knee pain. In another study, 3,257 symptom-free knees, of those, 25% had spurs. Now remember, they're symptom-free. So it's not an automatic thing that you need a surgery if you have a spur on the X-ray. Here's another study, 230 knees with no symptoms in the Journal of Skeletal Radiology. So half the people were under 44, half above. 97% had abnormalities. Cartilage damage, tendon or abnormalities, meniscus tears, ligament damage. But they didn't have symptoms. So just because you have a bad looking X-ray does not mean that you can't get better. In a 2018 study of 4,322 knees, 43%, that's almost half, had no knee pain, but cartilage defects. What do these abnormalities mean? Most are probably just part of the aging process. The bottom line of X-rays and MRIs, they are a part of the story, but not the end of the story. So what about inflammation? Dr. William Robertson from Stanford University has done a lot of research in this area and has discovered that there are certain cells called mast cells, when activated, lead to inflammation that degrades cartilage. Overweight, fat cells, and inflammation. First of all, being overweight puts more stress on the joints. And more fat cells can lead to more inflammation. So we'll be talking about this more later. If you are overweight, we have some strategies that can be very helpful. A lot of research in this area, inflammation and diet. Journal of Arthritis and Research and Therapy identified some foods as inflammatory and others as anti-inflammatory. With increased inflammation, there is increased risk for arthritis. So here are some of the bad boys: fried foods, high-fat foods, processed foods, simple carbohydrates, and lunch meats. Here's some of the good guys: fruits and vegetables, 100% whole grains. And this Mediterranean diet is very highly rated. We may talk about this a little bit later. But if you're taking a real holistic approach to getting your knee pain under control, definitely want to consider inflammatory foods, eating less, anti-inflammatory foods, eating more. A physical therapist named Joe Tata has done a lot of work with nutrition and chronic pain. He has pioneered the use of nutritional counseling in physical therapy to help individuals reduce chronic pain. This is best used with other lifestyle modification strategies such as exercise and weight management. And he has an organization called the Integrative Pain Science Institute. Now, more and more of us in PT are recognizing the benefits of talking with patients about nutrition. Now, we're not dietitians, but we use the research that's out there that talks about the best foods to decrease inflammation and the best foods that you should avoid. And so if you are eating a diet high in inflammatory foods, you really want to examine that and maybe try something a little different. Surgery is the last resort. The evidence is not really good for surgery for musculoskeletal pain, for joint pain. Only 14% of these surgeries showed a superior benefit. So that's not very good. This is coming out of Australia in 2020. Degenerative meniscus tears in the knee. A partial removal versus placebo surgery. 5-year follow-up results. Having the meniscectomy increased the risk of developing osteoarthritis. Now, your newspaper has solutions. Most require injections of medications, chicken fat, stem cells, your blood, and so on. But there's very little research to support the claims. And others require 40 to 60 visits with large cash payments upfront. Solutions: none of those advertised solutions teach you anything about self-management for the long term. Maybe they would reduce your pain a little bit in the short term, but you're not going to learn anything about how to manage it long term. Your first steps: try conservative approaches as described in this video. Before injections or surgery, get a second opinion. Get a physical therapy consultation. All right, I want you to take a little break and go through this past section of slides. And I'd like you to review what we've talked about and make some notes, make some action plans, and then we'll get on to the next section of the presentation. We will see you back in a little bit. Maybe you take more than a little bit and take your time.